I am Dr. Amit Kulkarni. I'm a Senior Consultant Neurologist and Stroke Specialist attached to SPARSH Hospitals, Mysore Road. How do you identify a patient has stroke? So there's a very simple acronym which is designed for public, and that says F for face if there is a sudden onset of facial drooping, A for arm if sudden onset of arm drooping or arm weakness, S for speech, that means there's any slurring of speech or even difficulty with finding words or not having a speech at all. If any of these symptoms happen all of a sudden, you can add two other things along with it, that is balance, sudden onset of balance difficulty, and sudden onset of visual disturbances or visual loss. So if any of these symptoms are there, then it is T, which is time to call the ambulance. If this thing happens in your neighborhood, what you must do is immediately call for help, shift this patient in the ambulance to the nearest stroke ready hospital. What is stroke ready hospital? It is a hospital which has all these facilities available like the CT and the MRI. It has around the clock neurologist, a radiologist who can interpret CTs and MRIs. It has round the clock neurosurgeons, a stroke unit, and a very responsive emergency team and the ICU team. So if these facilities are available in a particular hospital, it's called as a stroke ready hospital. Whenever there is round the clock availability of an interventional neurologist or interventional neurosurgeon, he is somebody who can actually do a manual clot extraction, and there is availability of a DSA or a cath lab. This is called as a comprehensive stroke center. So whenever somebody has got symptoms of stroke, we have to shift this patient in the ambulance to the nearest stroke ready hospital. So when somebody presents to a stroke ready hospital, what is generally done? First of all, as the patient arrives, the patient's blood samples are taken, because it's very important to see whether the blood is thin or how thin the blood is, to see some routine health checks including blood sugar level. And along with this, the patient is taken for the CT or the MRI. Before he does that or on the way, there's something called as NIHSS. So this is stroke scale severity assessment. This is done by either a stroke nurse or a physician or the ER physician who can actually evaluate the symptoms very quickly and come to a score. Generally, if the score is less than 5, it is said that it's a minor stroke. If it's between 5 to 15, it's said that it's a moderate stroke. And anything more than 15, it's supposed to be a severe stroke. So once the NIHSS assessment is done and the CT or the MRI is done, as soon as the CT or the MRI, CT says that there is no hemorrhage or there is no bleed, or MRI shows an infarct, what we need to do is immediately give this patient an IV clot buster drug. And this drug, what it does is goes through the intravenous route. It tries to recanalize the particular clogged artery or the blocked artery. Now, a lot of times, the bigger artery can be blocked, and that may not open up with this clot buster. So then what do we do? So in these people whom we know have got an ischemic stroke, we finish what we do is a CT angiogram or an MRI with MR angiogram. And based on whether there's a large vessel occlusion, if there's a blockage of any of these major arteries like the ICA, the MCA, as well as the basilar artery, if any of these arteries are blocked, then this patient is shifted to the cath lab with the drip on flow, with the clot buster on flow. In the cath lab, the neurointerventionist will do what is called as a DSA, which is an angiogram, and he will actually visualize the clot. Once he sees where the clot is, through the guide wire, he takes the catheter up, he passes what is called as a stent retriever, and through the stent retriever, he engages the clot and pulls out the clot. This has got a major benefit in terms of morbidity as well as mortality. Today, we are seeing that many of such patients are walking and talking. People who are likely to have been bed-bound, people who are likely to have died, today are able to walk and talk, and there's a significant improvement in the quality of life, seen either immediately at the time of discharge or 3 months down the line. Hence, anybody who is appropriate for this particular kind of treatment should receive it at all costs. I urge one and all, if you identify the stroke symptoms in your vicinity, in your neighborhood, please send them to the nearest stroke ready hospital or the comprehensive stroke center where these treatments can be carried out. Thank you one and all for a patient hearing.